Burnout has come up from a number of people in terms of being an issue of significant concern, which I think it absolutely is across programs and sectors. So I want us to spend a little time thinking about how do we do a more active approach to burnout prevention. So a few tips from, well, I guess first just asking you, what do you do now around preventing burnout that you feel like is working well?
Well, what we're planning on doing and what we're really seeing specifically is physician burnout. And that is really becoming a problem, and it is related to all of the new things that are going on in primary care, and all of the requirements that patients have to do, which a lot that physicians have to do, that they really see is interfering with care rather than supporting the care. So we're going to be doing a program for the providers in particular to address the burnout issue.
What kind of a program?
That's in the development stages,
So
but
some
it's
kind of
just
proactive programming.
initially, we're just realizing now how our providers are really experiencing burnout.
Great.
And
Okay.
so they're
So it's
they're
been
gonna be
recognized and you're
developing-
sort of figuring
right,
out
right,
what the strategy is going to be.
Exactly.
Other folks, yeah, Carly, you want to say
Oh
something?
no, I was just gonna say 2 minutes on that. First of all, right, that's a national issue in primary care. And primary care is being asked to take on more and more and more without equal money and resources being put towards it. And the other piece of it is just think, like you just have to think team. Because what's happening is lots of places are thinking that the physicians have to take on all the other stuff. Patient-centered mental home, well, the physician's gonna take on all those things. There's so much of patient-centered medical home that can be done by other staff members and other team members. And then you run into issues of doctors feeling like they don't want, they're nervous about giving up doing things, but they have to. And they have to, you have to have staff trained to help support them and work with them. Otherwise, the physicians will go. They'll be gone.
try.
Well, we are doing that, actually.
Yeah, no, I'm saying like lots of places.
Right, we
see
are
this.
having a support staff do as much as they can. We have even tried scribes to help some of the physicians. But even so,
Even
the
so.
burnout
Yeah.
is there.
Yeah.
Fair enough. Other folks, specific strategies that you've used that have been effective?
We have monthly meetings with each staff person, so
Mhm.
either with the team leader, with the program manager, and we look at the caseloads once a week, and so we do look at that in their meeting, and we have a certain level of case that we know is the highest acuity, and so
Mhm.
looking to like make sure that the person who's really at the top end of that doesn't get new cases, making sure our triage people are aware of how to look at the cases and disperse the cases. And then knowing that just because someone isn't getting their caseload up, like really talking to them about it, because they keep like discharging and admitting people, and that's
Mhm.
a lot of work,
Yes.
even though it doesn't show in the numbers. So just being able to have that conversation and reaffirming that to them. I know you're working hard, like I can see, you know, okay, we gotta, even though the caseload's at this, let's not send her anymore because it's admissions and discharges are happening here. So lots of communication.
Yep.
And then I'm all for off the record moments, and I tell the staff that if you need to come in a closed room and just freak out with me, go
Yeah.
for it.
Yeah.
Because we're not
That
gonna,
sort of saves support
let's
space.
just like, who's smoking crack here? You know, whatever, so whatever you gotta say. And then, all right, now let's move on to like, how we're gonna solve this.
Yep.
Use your team. You've sat with this case for so long. Like, let's ask our resources what to do.
Got it.
What
So
other
it sounds
things?
like active management of caseloads to make sure that they're as manageable as they can be.
And then on the fly.
Yeah,
Yeah.
yeah, ongoingly,
Mhm.
and creating that support space. Other folks?
I would just like to quickly add to what Amy has said. We also try to give them other opportunities to do something slightly different, like whether that be attend a different type of meeting or do a personal growth day outside of the office, or something
Just to kind of keep it a little more fresh.
Exactly, and just try to not do the same thing, you know, just to really get burnout in that same routine with that same high case. It's okay, let's take a day out and, you know, go to this meeting and try to, you know, just try to understand potentially the bigger picture too.
Great.
I'll answer quickly from the highest level, and Jen does the supervision of direct field staff. And I think from an overall statewide level, I think what we do well is really try to acknowledge and affirm the work that they're doing. And they're in a pretty new, exciting program that's getting more and more recognized of that. And they do a lot of direct relationships. So that naturally helps prevent it, but it's tough work. So I think a lot of acknowledgement and support around the work they do, and really listen to all of the field staff around what they need more of. I think where we have room to grow is around professional development. I saw on one of your slides, and we just talked about that. And that for the folks who are community health worker, care coordinators, the pipeline of professional development is what
Not
is
so
that
clear.
pipeline? It's
Yeah.
not that clear. They're not paid great. You know, it's coming out of CMMI and ACA, and it's not it's not high paid, really hard, really important work. So we try to acknowledge and all that a lot, but I think that's one of the gap areas is really showing them that pipeline for development and allowing for professional development, but just acknowledging and keeping up that excitement. But I don't know, do you want to add to prevent burnout? It's hard work.
I think people have hit it pretty well. I do think one of knowing who, Amy was here earlier,
Yeah.
knowing who you can go to with questions or in the middle of like, so I got my meetings and I got my stuff, but you know what, if I'm really like, knowing who's going to help with different things. This is a software thing. This person has I have a case and I need to, you know.
So who are your point people for the
Yeah.
things that you
Yeah.
need?
Yeah.
Make sure they feel
Who can I
really
reach
well
out to?
supported.
We really try to, it's hard in the moment, but if you can help them find the answer, let them find it without giving it to them, then they can like do that for the next person.
Yep.
Really,
To put
really,
that capacity
really
building.
hard to do in the moment, because you know the answer and you want to give it to them, because it's easier for me to give them the answer.
Well, and I've noticed it gets where the check-in times, all of a sudden, check-in times are the same amount of time, but it feels like, I have this list for you. And so I have to fight against I have a question, I answer it. I have a question, I answer it. You know, like we got to get out of that groove that happens when you're in time-limited crisis.
Right.
Well, I think you said that at the beginning, is
I
how do you
did.
shift out of
Yes.
a crisis to crisis mentality into something that is a little more expansive and less draining?
Right,
It's challenging.
right.
And with meeting, you know, NCQA standards, which a lot of us are trying to meet, I think sometimes you spend a majority of your time might not be the most important thing. So like getting people to understand that, yes, it takes a lot of time, but that's not the most important piece of what I try to equate it to like nurses giving medicine. You've got to get the meds out, but it is not like giving the medicine is not the most important thing. Like shoveling it into someone or whatever. It's all the things that you have to think about, you know, why you're giving it to them, what you might be seeing,
Yeah.
how you put all that together.
It's tricky to balance all that,
really
for sure.
tricky. And to teach that is really
So a few recommendations here. I think just meeting staff with empathy, even if they're not performing the way you would like them to be, is a really good starting place. There are very often systemic and structural factors that make our work harder and that we tend to focus. I mean, this is something, the conversation I have a lot when we're talking about working with clients is it's easier to focus on the individual factors because they're often easier to change than thinking about what are the systemic factors that are keeping somebody stuck with their health and their mental health the way that it is. So I think that's true for staff too. I mean, I look at things like, you know, for community health workers, what is the pathway? You know, on the salary that they make, can they afford childcare and to finish the degree that didn't get finished? What does it mean to work in a system? I mean, in Boston, we have a huge shortage of affordable housing. So anytime you want to collaborate with the housing agency, you can't get a person to pick up a phone. They don't answer email. If you go in there, you wait and wait and wait. And so the system is so overburdened, there's no collaboration and communication that's really even possible. And it's maddening for the staff. So to be able to acknowledge the systemic role in creating their stresses, so they're not just like, why am I not better at my job? It's like, no, that's not really what the issue is at all. I think a strengths perspective, we've talked about ongoing professional development. I think flexibility is a huge thing. So when I was little, my mom was a nurse, and then she worked for the VNA in Boston. and then went on to be a supervisor of visiting nurses. And almost all of her staff had either small children, parents that they were caregiving for, or their own health issues. And, you know, and my mom very rarely had to fire people. And so I was like, you know, how do you do this? And she's like, it's all about being flexible. So, you know, there are some people who come in early and leave early because their kids to get on the bus. There are other people who have to leave in the middle of the day to go to the nursing home for a care planning meeting for mom. There are other people who we have to like flex their hours because they're working with a long-term chronic illness, and that's just the way it is. And so she expected, you know, high performance, but that their decision as a program was that they were going to work around helping people meet their other life responsibilities.
Because they could still meet the patient's needs.
They did, and they did a great job, and then people
probably
didn't
were
leave.
much happier.
They were. So I think I learned that from her. And you can be overly flexible. I think I tend to skew towards overly flexible, and then it makes chaos. So there's a middle grounded place with that. Modeling healthy boundaries. So often people will say, oh, my staff are so burned out, and the person who's the team leader is eating their lunch at their computer, their phone's ringing, they're answering 5 emails, and you're like, oh, you're getting on a, you know, you're getting your car in an hour to go to a meeting across the state. You're like, no wonder your staff is burned out. You're like Frazzle-a-rama, which is, again, not really our fault, but if you can't set boundaries and do your work in a sustainable way, your staff are going to have a really hard time doing that. And when I've worked with staff in other programs and said, you know, if you get assigned another client, you may have to say I have no more room. And you're like, my boss is there till 8 o'clock at night. How can I tell her that I'm not willing to do this when that's what she's doing? So it's something to be paying attention to. And I think just attending to relationships, I mean, I think that's really the key in so much of this work is if you have a strong relationship with your team, with your supervisees, with your collaborators, all the rest is more navigable and more possible. I don't really want to skip the activity, but I'm afraid I'm not going to have enough time to do the last piece. Carla, what do you think? Should we do the brainstorm? Should we skip the brainstorm?
Well, we could ask them, I mean.
Okay, so let's do that. So we have an hour, and so we have a group brainstorm activity around burnout prevention that I wanted to do with you, both because it's an interesting topic, but also the brainstorm process is a useful one for other kinds of issues. So we can do that or skip it. And then I want to have a chance for you all to do some practicing with each other of the motivational interviewing approach to working with problematic staff behavior. So I have a tool I want to review with you, and then I want to give you some time to practice that. Can I ask a clear question?
Do you want me to ask it?
I appreciate you telling us what the choices are.
Yeah,
I appreciate
that.
that.
Staff.
Okay.
Do we have a choice of one or the other?
Yeah, so we could cut the burnout activity, and then you have pretty much a full hour to work on this brief negotiated interviewing technique.
Or we can do a shorter
do burnout
brainstorm and then do a
much
shorter
version
practice
of
time.
the MI stuff.
So how do people feel?
Short brainstorm or shorter?
I agree. I
Yeah,
like to get a
sure.
sample of both.
You want
Yeah.
to say?
But that doesn't mean you guys have to.
So, so let's just see, who wants to just skip the brainstorm and go right to doing MI stuff next? Sorry, we'll just try to do this quickly.
Let's do 20 minutes, so by 3:15 we're done with burnout. And
Okay.
we have 45 minutes to do brief negotiated.
Great, okay. So, I'm gonna give
Purple, all right.
Post-its here. Oh, so if you all can split those among the 3 of you, and if you all can split, everybody needs some. So the thing that we're going to do, this sort of fits in with what Carla was talking about this morning about continuous quality improvement. So we used to, I think about quarterly at our team meetings, do one of the QI activities. We have this little book that the brainstorms come from. As a way to talk about programmatic issues, getting input from everyone on the team. So I want to give you a sample. The thing that we're going to do is called an affinity brainstorm, and the directions are on a handout in your folder, so you'll have it if you want to use it again. So I'll just walk you through it, and we'll skip the last step just to make it go more quickly. So what I would like you to do is, on your Post-it, one idea for each Post-it note is write down something that contributes to staff burnout. And you're coming up with as many things as you can. And if you can write legibly, that's good.
Each sticky?
One item on each sticky. So an example would be low salaries or Yeah, you get the idea. All right, do I have more to select from here? Okay, that's something else. Does anybody have any of these that I haven't collected? Okay, so if everybody can come up here, this is a hands-on thing we're gonna do now. These are so colorful. So I think one of the reasons I like this process is it's a great way to get, sometimes if the director of a program makes a suggestion, everyone runs with that, and the person who's the front desk person says something, and it kind of goes out. This makes everybody's input equal. So what I would like you to do is, we want to cluster these factors into categories. So putting things that are the similar or the same together. And the catch is, I want you to do this in silence. So let's say I come up here and I see time constraints. And I'm like, okay, what is that kind of like? So I'll take time constraints and maybe I say it's like not enough resources. Sort of a similar lack of resources outside of the individual person. So I'll cluster them together. So you're going to make them in little bunches, and it may be that Amy comes over here and she says time constraints. I don't think that really goes there. I would put that with, I don't know, some other place. So you may move it, and someone else may move it somewhere else, and we're going to stay here until we have a couple of clusters that everybody feels okay with. Okay? So
Sorry, the wall didn't.
yeah, the wall was
wasn't
not
sticky
cooperating
enough. I know
with
it's a
us.
little crowded, but.
So have at it. So what we're going to do is just go through these clusters and then name them. And we may decide as we go that some of them should join or they should separate, depending on kind of how the group is thinking about them. So we've got high caseload, high case overload, not enough staff, short staff. Those all seem thematically similar. What would we call this if you were going to give the category a title?
Work overload.
Staff to case ratio or like,
You
you know what I mean? Like,
Staff to case ratio, what do people think about that?
Yeah.
Okay. Challenging client behaviors, hostile environment. I don't know about that, I'm gonna come back to that. No focus on team values, feeling like you have no say, not enough appreciation, not feeling appreciated and recognized. Respect? Anything else?
Valued, yeah,
Value.
respect, something in that vein.
Is there something that needs to move over, do you think? Okay.
Maybe
And poor training. So what do people think? Poor training goes in feeling valued or
There's
somewhere else?
something about policies over there and unclearness. I almost wonder if we're trying to look at that.
All right, well, let's
Paperwork.
let it be over here, and maybe it'll join up somewhere. Lack of professional growth, losing the sense of the self-reward in what you're doing.
that says lack of professional development.
Okay.
Lack of
Repetitive responsibilities, lack of stimulation. Okay. So those, I think those, we'll see where we are. I don't know, what do you think about, this is client factor, it seems like, and hostile environment. I'm not sure where those go, so we'll keep going. Paperwork, data entry, too much change.
No, I think those are close together.
All right. Do you want to just go revisit over here and see if you want to cluster differently, maybe find a home for this one, and then we'll relabel it. Lack of communication system, unclear communication, unclear policies and procedures, lack of communication, or lack of community. What would you call this?
Yeah.
And would that unrealistic expectation of roles, poorly defined roles go with it? Just that? Get in
Yeah. Okay. Got it. So lack of resources, equipment failure, no support, adding more things and not taking anything away. That's, I think, the same as
Limited
increasing
resources?
demand, right?
Yeah.
Let's see. Not enough resources, no flexibility, time constraints, travel, not enough time. Okay, so what would we call this cluster here?
there. Reality?
It's really limited resources.
Mm-hmm.
Yeah.
Yeah, in different ways, whether that's time or money.
Right,
Okay.
regardless.
Got it. Lack of professional development, repetitive responsibilities, lack of stimulation, lack of professional growth, lack of challenges, losing the self-reward in what you're doing. Stagnant. Yes. No growth. Great. Okay, so we have poor boundaries as an outlier. Where would that one go? Challenging behaviors in clients, poor boundaries. And paperwork.
Data entry, I would imagine probably.
Something related to workload, staff
Should
case
we wanna go up
ratio,
here?
Yeah.
Okay. Yeah, maybe workload is more general.
Yeah.
Right.
And so what would we call the boundaries in the client category here?
Interesting, I wrote both of those. This one has to do with an external force.
Mhm.
This one has to do with internal.
Yeah.
Okay, so having poor boundaries oneself.
Right.
Yeah.
You can burn out often if you don't take care of yourself and you do too much.
So this is external
Yeah.
and this is internal. Interesting. Okay. So shall we just look back over this? So we have workload, organizational culture, respect, feeling valued, but I think it's actually not feeling valued, right? External, internal factor, communication, reality, otherwise known as limited resources, and stagnant or no growth. People feel good about those titles, or is there something missing or something you would label differently? Okay, okay. So-
Can I ask a question?
Sure.
So this stagnant kind of group, does it, I don't know, is it a label that is helpful in terms of thinking about this? You know what I mean? Like it's not a, what am I trying to say?
Yeah.
Like it's not a thing, at least to me, it's not a thing, it's more a description.
If Carla, if you were going to propose an alternative name, what would you propose?
What are the things in that group under stagnant?
Losing sense of reward in what you're doing, lack of professional growth, lack of professional development,
How
lack
about
of
something like
challenges.
lack of recognition or lack of, do we
No,
have
That's,
that?
yeah, it's a different
That's a-
category. Lack of opportunity.
Yeah, lack of opportunities.
Yeah.
Limited opportunities.
Limited opportunity, yeah, like a thing,
Limited
right, instead of an
opportunities, yeah.
adjective.
Okay, that's, people feel okay about that?
Yeah.
So we'll stick to this. Okay. So so we have a pretty good kind of map of the different factors that contribute to people feeling burned out. So I guess my question to you, if we were a team trying to tackle this, is which of these things, like from the perspective of, like if we all work for the same program, which of these would be the thing that you feel like either is the highest priority to work on, or the thing that we would be able to have the most likely positive impact on among the clusters of factors?
Well, feeling respected.
I feel like you gotta go for that first.
Okay.
It seems like it's the easiest to change too.
Okay, so
In some ways.
You may have control over it.
May have
That's
control.
what it is.
That's
You might
my
wanna
point.
go to
Have to control.
caseload, but you sometimes can't affect that.
Right.
You can affect the organizational culture to some degree.
Which is a little slower process
Yeah.
than maybe the
That we're
communication.
taking
That's why.
communication. Yeah.
Okay,
It's
so
a
that
little
would
slower to
change, but it would
change.
be slower to change, and communication. Okay, so it sounds like these are the two that sort of are clearly more impactable in a short-term way. So among those, which of those things feels more like a priority from where you're coming from, just thinking about your program now?
I have to say, once you have
Well, I
communication.
think it starts here, and
Yeah,
it trickles down to that one. Okay, so this may actually be a result of that?
Right.
Okay, so that means we start here. So this is more of a result, and this is more of a catalyst. Interesting. I think that's so. I wouldn't necessarily have thought about it that way. So if we were, so we're gonna, where am I gonna put these? Maybe we just put them on the table for right now. We can look at them all together for a minute. Yeah. Just because there's too much going on. So if we go over here, we've got in this cluster of communication, lack of communication systems, communication barriers, unclear communication, unrealistic or poorly defined role, lack of communication, unclear policies and procedures. So if we were going to think about a couple of really specific action steps to improve communication or address some of the variables in this cluster, what comes to mind? And again, this would be more useful if we all work for the same program, but if you think about your specific program.
Well, if you have policies and procedures in place, that helps in the
Mhm.
communication.
So if
process.
we're looking at unclear, an action step may be revising the policies and procedures to clarify or reviewing them in some meaningful way. I know a lot of places I've worked.
Even collectively.
Yeah, that you get the policy manual, it goes on the shelf and you don't open it again for 3 years, you know?
Right.
I think the number one thing is identifying what communication works for people. Some people enjoy getting 100 emails. I personally, do individual meetings, do staff meetings on a more regular basis.
So some assessment around preferred communication methods for different
Or
people on the team.
trying to do multiple different types
Mhm.
to meet everybody's needs if you have a big group.
Great.
It's very hard with communications, particularly when you're in a small organization and primary care and you love to hold meetings, but you have patient schedules that get in the way.
Yep.
And
Providers part-time.
the providers are part-time.
Coordinating with
You
part-time
can't-
staff is
you-
so
you
challenging.
can't- You can't get everybody together and, ideally, I think meetings are a great way to communicate, but
Doesn't work all the time.
it just does not work all the time.
Okay.
And half of the staff doesn't get the message.
Also, the other thing is sometimes communication is a big, huge word, and what do we really mean by communication? I mean, sometimes communication can be that there's no process, meaning we have, and this is new work, right? So there are lots of times, I'm guessing, where there is no process, no one's ever sat down and figured out what the process is, and communication can be, well, yeah, at that step, all the care coordinators should be notified, or at that step, the docs should be brought in, or
So there's a
not.
flow, kind of.
Right, and do we all agree about that? How's that gonna happen? How are we gonna check it, right? So that can be communication also, and just some people don't even realize that that's what the process is.
Well, I'm thinking too, just about how staff prefer to be communicated with. A lot of the teams I work with are mobile, so they're out in their cars, and so usually a text or an email is the easiest, thing to do. But then sometimes we've sent sensitive information over, a text, and someone's like, I pulled to the side of the road and found out that so-and-so was in the hospital. That's not the way I want to receive that information. And so we had to come back and sort of revisit, our communication policy. What are the kinds of things that someone needs to receive a personal call to hear, and what are the kind of things that are okay to send in an email or a text update? And so the policies got revised from there.
And I think it's a combination. There's individual communication, or one-on-one communication, there's communication through emails, communication through meetings.
Mm-hmm.
And sometimes people have to be responsible for one of those modes of communication.
Yes.
Like,
Yeah,
you
make
can
a
do lots of
commitment.
things,
Of
and
course.
okay, we'll do various ways, but you gotta step up to the plate and be
Mhm.
responsible for some of that.
Right.
Absolutely.
The other thing is, in this team-based world that we're working in, right, what I find is that
who's the accountable person in a particular process. Like, we may agree this is the process, but there may be, again, certain points in that process where one person has to make something happen or not, right? And we haven't always had those discussions on the team, like, who's responsible for this piece of it? Right, so it's like communication, is the problem you're getting too much, or is the problem you're not getting enough? And if you're not getting enough, why? Probably not because someone intended not to communicate with you, because probably everyone was like, I thought that was somebody else's role to do that. I didn't know that was my role,
Yep.
right? And those are hard discussions to have.
So, and
I'd
this
like
is,
to give an example on that came up recently. We have monthly NCQA meetings. We had a facilitator. The facilitator, the one that we were working with, no longer there. Another facilitator is going to work with us, but she's going to communicate with us remotely. At this point, nobody knew or who has the lead in this. I didn't know, do I take the lead in it? Is this new facilitator going to take the lead? Are the people from our MSO? And when you don't know, you feel, well, where is this going?
Right.
And I know
creates
we're on the same team, and I think we both felt that way.
Right.
so this would be an interesting moment if we identified, you know, as we talked, that the issue really was unclear communication. We might do another round of brainstorm and sort of say, okay, what are the factors that are contributing to lack of clarity? And it might be indirect management style. It might be conflict on the team that people are avoiding. It might be the email is really crappy, or people's smartphones, you know, are not getting messages in a reliable way because of cell service. It could be we haven't set clear expectations about how often people are supposed to check their voicemail, or you know what I mean? So we could do a whole other round of brainstorm to get more clarity and specificity around any one of the issues that gets raised. So I want to stop us here, but you know, normally if we were going to carry the process all the way through, we would do some SMART goal setting around, you know, what do we want to do to follow up on the issues that we've identified, and it may be that, you know, it takes a whole other round to get to the
That's
thing.
so interesting.
that are the
So
action
again,
steps.
Another thing to do with staff that you do is, that's really.
Yeah.
Yeah.
Smart
Didn't
goals
even
and
think about
management,
that.
smart
Yeah.
expectations.
Yeah.
Yeah.
But it's, and also, you can set a SMART goal for the team. So
Right.
it may be that, you know, we all make a commitment that we're going to read our email every day at 4:45, so that when we come in the next morning, we're not like, oh, I didn't know that happened.
Right.
Or that, you know, everyone's going to commit that if it's something important, they send a text rather than just sending an email, because not everyone can access their email remotely, or whatever the issues are. But I think the goal setting is really important. So this isn't just an exercise, it's something that actually has impact that around the things that the team identifies as a priority.
Right. And it's a team decision, not.
But then there's always, right, a person who has to measure it or
Right,
follow up
sure.
on it, you know, there's that, because you have that team thing, you're like, great, and everyone goes away, and then no one follows up, right?
Right, and if it's something like unclear policies and procedures, it may be there's a committee that does policy revision,
Yeah.
and they come and check back in with the group when they've done a round of editing and see what people think. So there's a lot of different ways to go about it, but what I like about this is everybody's input is equal. We don't know who said what. You know, things get arranged, and then the group together sort of decides, okay, now that we have a little better understanding of this issue, where is it that we want to focus, and what else do we need to explore to be able to have some strategic impact. Does that make sense?
I like it.
So the flow of this and an example of it is on a brainstorm
It's in your
handout
packet.
that's in your packet.
Yeah.
So folks can sit. And of course, I can't spend the time doing anything. So we're gonna do this.
Don't worry, I'll keep it on.
Yeah, no, it is what it is. It's okay.
You go for it.
I always wish I had supervisors for longer, because there's so, like, I have worked with some brilliant people over the years, and I'm like, oh, I'm stealing that from you. I'm stealing that from you. So with credit. But it's just really nice to see different proactive things done that I've seen have a positive impact on teams and on people feeling respected. Because I do think burnout is something that you can prevent. You mean not, you know, people maybe will hit a threshold at a certain point, but when a program is well managed, the things that lead to burnout get addressed, and then people don't feel like they have